Welcome to Alpine Learning Group's Innovation in Autism Webinar Series. Alpine Learning Group offers a full range of diagnostic and applied behavior analysis-based educational services to individuals of all ages. Each year during Autism Acceptance Month, we share our expertise through free webinars and make them available to our community. At the close of this presentation, we will share a QR code to learn about the presentations in this series. My name is Amira El-Boghdedy. I'm a teacher and board-certified behavior analyst for nearly 12 years at Alpine Learning Group. I've had the pleasure of working alongside a group of innovative and compassionate leaders in the autism field. I'm happy we're able to share their expertise with you today. Today's webinar is Sexuality and Autism Spectrum Disorders, Key Variable to Consider. We are joined by Dr. Frank Cicero, a licensed psychologist and board-certified behavior analyst with over 25 years of experience in applied behavior analysis, autism, and pediatric psychology. He is an assistant professor and ABA program director at Seton Hall University and maintains a private practice focused on best practices for autism and developmental disabilities. Dr. Cicero is nationally recognized as a great speaker, and he brings his deep expertise in addressing problem behavior, ethical practice, and skill development across the lifespan. We are very grateful for his willingness to share his insights with us today, and now I'm going to turn it over to Dr. Cicero.
Thank you very much. I'm glad to be here. Thanks for that little bio read. I just want to highlight, so I am a licensed psychologist. I'm a board certified behavior analyst licensed in New York and New Jersey. My psychology is licensed in New York, so I have my private practice in New York, and I am full-time here at Seton Hall University as the ABA program chair and associate professor. But I want to note that I'm not a sex therapist. So although I am a licensed psychologist and I'm able to work on targets within this area with people, I do not have a license in sex therapy. What we are going to see that is not actually necessary, because we're going to see that what we're working on a lot of times in behavior analysis with autistic individuals is we're working a lot on social skills, actually, and we're working a lot on communication skills that then allow them to have a more pleasurable, effective, and appropriate sexual life. So you notice here that this presentation is called Key Points to Consider, and that's because we only have 50 minutes. So it's a very short period of time to discuss these topics. So it's really just an introductory talk more than anything, right? So we're gonna kind of be introducing you to concepts and things to work on in this area, rather than really go in depth with anything. So I'm not going to, read out this definition. This is the definition of sexual well-being according to the World Health Organization. This is the current definition. And you do see that I have some words highlighted in red, right? So this is not a simple topic. It involves physical characteristics, emotional, mental, social, right? We want to be positive and respectful. And we also want to make sure that sex is pleasurable. So when we work with people with developmental disabilities, we oftentimes forget, we're so focused on safety and so focused on social appropriateness that we sometimes forget that we also have to teach pleasurable behavior, right? So because sex is supposed to be pleasurable, and that it is the sexual rights of all persons, and that is the belief in the United States. And here, what is defined as sexuality, once again, by the World Health Organization, it's a really complex definition, right? So it's going to involve sex, physical sex, right? Gender identities, roles, sexual orientation, eroticism, pleasure, intimacy, reproduction, right? It includes all those areas that we express our sexuality, right? Our fantasy, desires, beliefs, attitudes. And we have to carefully work in this area. For anybody who's a treatment provider here on the webinar, we have to carefully work in this area because sexuality is influenced by biological, psychological, social, economic, political, cultural, legal, historical, religious, and spiritual factors. So it's really complex, which once again explains why we're going to just really be talking key concepts here, right? Keep in mind that human sexuality is an area where you can get a doctoral degree in human sexuality, right? So it's a really broad concept. And autism spectrum disorder, as we know, is an extremely broad concept, right? So with individuals with very widely differing needs in the autism spectrum, right? So when you have a talk on sexual behavior and the autism spectrum, that would be a literally, I'm not kidding you, that's a 2 day talk to really go into in depth on all the different topic areas that are out there. So we have a very short period of time, and I'm going to hopefully highlight and introduce some things that then you'll be able to go forward and ask other questions and seek out other services if needed, and get some consultations or attend. We could even schedule additional webinars here, depending on what Alpine wants to do. Right. Just very briefly, and then hopefully we're gonna get into treatment pretty soon. Um, Studies have found that about 75% of individuals on the spectrum desire some form of sexual behavior. That leaves about 25% that really don't seem to have too much of an interest in sexual behavior at all. Interestingly, that's actually a typical percentage for the population at large. So it has nothing to do with autism. About 75% of adult humans are interested in sexual behavior, and about 25% of adult humans have very little to, if any, desire to engage in sexual behavior. So autism's pretty normal in that respect. And what do individuals on the spectrum engage in when it comes to sexual behavior? Well, we have everything from solo sex, which is masturbation, to full sexual intercourse with a partner, multiple partners, and all behaviors along the way and in between. So that's actually pretty typical as well, right? Where individuals get affected, right, by what type of sexual behavior they're going to be engaging in, it seems to be it's affected by their knowledge, by their desires, obviously, experiences, and also related to their cognitive abilities and their social skill development, right? So it's not that individuals on the autism spectrum have any more frequent incidents of biological, physiological, sexual um, issues or even psychological sexual issues more than a typical neurotypical population, right? But it's their cognitive abilities that are affected, their social skills that are affected, their cognitive skills that are affected that will affect the not the desire of the sexual behavior, but the appearance of the sexual behavior, the sexual expression, right? So where individuals on the autism spectrum sometimes have issues is they engage in sexual behaviors in the absence of having well-developed social skills, communication skills, sometimes cognitive skills, um, and a perspective of mind, perspective taking theory of mind skills, right? And therefore, the way that their sexual behaviors are observed by others, the way they engage in their sexual behaviors within the environment can come out looking socially inappropriate, socially dangerous, um, misinterpreted, right? Misinterpreted by others. And we're going to talk a lot about that. But the majority of consultation calls that I get when it comes to sexual behavior, which is one of my areas um, that I work in frequently, um, many calls are for problem behavior, right? Or I should say, what parents and school programs consider to be problem behaviors. Um, masturbation in public, exposure in public, stalking people that they're interested in, inappropriate conversations, inappropriate touching of others in public, um, looking at pornography on computers at school, in the library, um, sexting on their phones to strangers or to uh, people, familiar people, right? So these are a lot of calls that I get. But keep in mind that none of those behaviors, actually, I'm already jumping slides. This is a bad habit of mine. Keep in mind that um, all of those behaviors really are not inappropriate behaviors, right? So they're not problem behaviors, right? Touching someone that you're sexually attracted to is not a problem behavior. Masturbating is not a problem behavior. Having sex with people is not a problem behavior. Sexting on your phone is not a problem behavior. Looking at pornography is not a problem behavior. Trying to go to someone's home to ring the doorbell to ask them out on a date is not problem behavior. Calling somebody on the phone is not problem behavior. Right? Why is it problem behavior? It's being done in inappropriate settings. It's being done in relation to inappropriate people. It's being done at inappropriate times. It's not being communicated effectively with the words that the autistic person is trying to use. The words are misinterpreted, right? The body language is misinterpreted. Um, so when I get a consultation case, once we start to sift through all the information, we start to realize the behavior is not problematic, right? There's nothing necessarily problematic with looking at pornography if you're an adult, looking at pornography on your computer. It's all a matter of time and place. And that is where autistic individuals oftentimes have issues. Why is that? Because of their inherent social and communication deficits as a result of their autism or cognitive deficits as well that are comorbid um, with their autism, right? So if I was giving a much longer talk, right, on this topic, and oftentimes I do, we would have talked much more about that concept and the social skills and how development happens, right? But I'm going to jump ahead here because this is key concepts. I'm going to jump ahead to some domains for selecting goals, right? For a good, comprehensive uh, sex ed curriculum, right? Noting that this is definitely not an exhaustive list, what I have up here. Right? There's plenty of other things that have to be taught, can be taught, ideas that I didn't come up with, ideas that I didn't think about right now when I was creating the slides. Um, we also have to think of this topic as, although this is a comprehensive kind of sex ed curriculum ideas, the individual that you're working with doesn't necessarily need all these goals, right? So you don't have to teach everything to all individuals, right? You could ex ex explore concepts with individuals as that individual needs it to be explored, right? And who determines that need? Honestly, it's the client, right? It's the person themselves, the person with autism themselves. They determine their own needs. Now, I understand that many individuals on the spectrum can't express those needs through words, right? So you can't necessarily ask them, what do you want to work on? And they'll tell you all the sexual thoughts going on in their mind and what they need to work on. However, through a good assessment of the environment and an assessment of their behavior, what they are doing, and through using good clinical judgment, in collaboration with a behavior analyst and I should say a behavior analyst that's specialized in this area, you can try to determine the goals that the individual would want worked on, right? If that person is not able to communicate for themselves effectively. So here's just some general areas of core knowledge and independence that need to be taught. Personal hygiene, sexual body parts and their functions, like what they do, what their names are. Now that I'm talking that program changes over the course of time, right? We're not going to have time to talk about all these things in depth, but certain things enter my mind when I'm kind of prompted by my slides. Something like sexual body parts and their function and even personal hygiene, the goals change over time. It's not like you're mastered and it's not, oh, I've mastered sexual body parts and function. No, because let's say a 4-year-old, I'm not talking, I'm not even going to say autism, just a 4-year-old, right? They need to know that their penis urinates, right? They need to know that their penis shouldn't typically hurt. It's not a body part that hurts, right? And they might need to know that sometimes their penis gets harder than usual, like it's a little bit more erect than usual. And that's okay, right? That's not a problem. That's okay that that happens, right? Do they need to know more about what their penis does at the age of 4? No. No, it's not really part of their world. They might need to know some safety things. Who could be seeing their penis, right? And they might need to know, they should know other words for penis because people don't always go around saying penis. In fact, they usually don't. Right? So you might want to cue in your younger ones to some younger words that they might know for that body part or what you want them to call that body part. Okay? And that's what they need to know. Where would they learn that? Well, discrete trial instruction. Right, you could if also you could use discrete trial instruction, you could use a lecture, you could use visuals to teach their body parts and their functions. Now, when a person is 12, now that needs to change, right? Now we might want to call it different things. Now you might need to know words that people use that you're going to hear that are now words that you wouldn't have wanted a 4-year-old to use for penis, more street words. But now you might have to have the 12-year-old know what those words mean, right? And 12-year-old, 13-year-old, a 15-year-old, 17-year-old, now we need to know different functions of penis. Now there's going to be different fluids coming out of the penis than just urine. So we need to add that. So once again, and then the personal hygiene changes because of that, right? So these are not programs that are done. They're like, oh, he knows his body parts, sexual body parts. No, he knows them for a 4-year-old. Now I need to teach it to him as a 10-year-old, and now I need to teach it to him as a 16-year-old, right? Even who can touch your penis changes depending on the person's age and their desires and their environment. So I know we always say only the doctor and only your mother and only the doctor and only the father can touch your penis. But now he has a girlfriend and he's 23. Right? So I don't know. Does the girlfriend is she included in this circle of being able to touch your penis? That would be up to that team to decide. And the client, don't forget the client, right? To decide, does that girlfriend come into the circle of people being able to touch your penis safely? Right? By the way, the girl might need to be taught with her team, if she wants, how do you touch penises safely? And why would you ever do that? And what do you do when you touch a boy's penis, man's penis, right? So I'm probably saying way more than you thought you would need to know about this stuff. And I might be, for if some of you have younger kids, I might be projecting a little bit more into the future here. I might be projecting a lot more into the future here, but these are the key concepts that you might need to start to think about, right? Adolescent development, physical, sexual behaviors, like what is sex? And once again, does everybody need to be taught everything? No. Only if they have that desire and they have that need to learn some concepts, would you necessarily have to go in that area, right? Solo sex behavior, so teaching how to masturbate. Social awareness and skills, public versus private behaviors, identifying different relationships between people, and what's appropriate behaviors to do, appropriate social spaces, touches, what conversation topics can you have? Perspective taking, that's a whole chapter in and of itself. How to teach individuals on the spectrum good perspective taking. flirting, dating, communicating behaviors. That way they don't wind up with stalking charges and saying inappropriate things in public and trying to ask somebody out. And I work a lot with uh, all learners with autism across the spectrum, right? So in my practice, I have individuals that are very challenged socially, communication, cognitively, right? And for that, we are working a lot on solo sex behavior, public and private, hygiene, keeping clothes on, not touching people in inappropriate places and in within inappropriate relationships for certain touches. And then I'm also working with an Asperger's sort of level adult. Um, and we are working on things like flirting, dating, communicating, actual sex, right? Behaviors. And a lot of those come across my way, even sometimes legally. Like there have been some legal troubles with with romantic, well, who they thought were maybe romantic partners, but they weren't romantic partners. So they've come across my path. For some individuals, like I said, we're going to be talking about sexually transmitted infections. We're going to be talking about pregnancy, inappropriate or unsafe behavior, how to make choices in your life, right? And choosing or maintaining abstinence, reporting abuse, being naive about certain topics, even though you're in the world, right? How do you identify a prostitute? How do you identify what do you do at a bachelor party if there is a an adult dancer there? Um, how do you navigate these situations? What do you do? What would be safe to do at the Jersey Shore in a bar on a Saturday? Um, Knowing that not everything is safe and not all people are safe and not all actions are safe. Once again, this might not be your son or daughter or individuals that you work with that would need these things. But once again, I have 1 hour talk. I don't know the audience. I can't really gear it in one way or another. So I'm giving you key concepts that individuals on the spectrum struggle with sometimes. And then there's these things that I work with as well as being a licensed psychologist that maybe a behavior analyst wouldn't always be the correct person to be the only sole provider on. Looking at things like anxieties or looking at things like intimacy issues. Even that I would probably call in a sex therapist. If there's a physiological or intimacy issue with erections or female arousal diagnoses, I would call in an expert myself that deals with neurotypical sexual physiological issues who would be a sex therapist. Things like post-sexual abuse trauma. Unfortunately, individuals on the autism spectrum are at a way higher uh, rate of sexual abuse than neurotypical children of the same age. Um, and once again, that wouldn't be me. Like that's not my specialty area. So I would call in an expert to work on post-sexual abuse trauma or refer my client out if that's something that I was working on. So the very first thing when I get a case, right? Um, the very first thing I do is look at a differential diagnosis. What do I mean? I have to make sure that the people tell me the problem behavior that they're having or what they want to teach. And then I have to determine if that is truly sexual behavior or not by what in behavior analysis we call function, right? So I have to look at why is this person doing this behavior? Is it truly sexual behavior? Is it an attention-seeking behavior? Is it to escape something? And what's causing the problem if it is sexual behavior? Is it due to the cognitive skill level? Is it due to a social skill deficit? Is it due to a lack of generalization? Right? Is it due to a communication issue? And I have to look at all these factors to look at what is it that I truly need to teach and what type of services are needed. A behavior plan, a counseling service, a teaching plan, a combination of all those things. Do I need to get this checked by a physician? Do we need to look at medication? Right? So I need to put this all in my head, right? So a behavior analyst psychologist is like a detective in this sense, right? We get given a problem and then we have to try to figure out what's the function of the problem, what's the cause, and what would be the intervention and once again, always thinking what the client would want. I don't work for families, right? I work for clients. I work for that person. I work for that person with autism, addressing what would better their life, not the family, not the school, not the community. Now, while teaching, remember, sexual behavior, we're talking religion, spirituality, legal, the law, politics, um, social, history, historical. We're talking a lot of factors here. People could get in trouble. So while teaching or even recommending treatments, this one I read out. Make sure you are aware of issues regarding consent, legalities in your area, wishes of the parents, policies of your agency, your school, and your district, your rationale for teaching the skill, and how your intervention or recommendations will be perceived by others. Because we never, working in this area, even as a parent, you never want to make it seem like you are teaching sexual behavior for your gratification or teaching sexual behavior the way you would do it and the way you think is correct. We look at our client and we also look at how other people will perceive what we're doing. And once again, literally legalities. What can you legally do? Right? And you have to have that knowledge. And that changes state by state, right? In the United States. It certainly changes country by country. So checking time here. What an hour goes by quick. What teaching methods do I use? I use whatever teaching method the individual learns with, right? So I ask parents and teachers, had they learned how to make a peanut butter and jelly sandwich? Had they learned how to do their laundry? How did you teach them how to communicate colors? How did you teach them how to make a choice? How did you teach them how to say hi to their friend? And I gather all the different teaching methods that parents have used, all the different teaching methods that the school has used, the ones that they've used successfully, I use for sexual behavior. The ones that they have not used successfully, I don't use because it's not the way the learner learns, right? So there is no way to do it. There's no, this is how you teach sex. This is how you teach sex education. There's no right and wrong here. There's also not a lot of research, I have to tell you. Behavior analysts love their research. Not a lot of good actual treatment research. And the treatment research that's out there, some of it is inherently really flawed, even in places like Journal of Applied Behavior Analysis. I'm not saying necessarily experimentally flawed. That's why it got published. But some of the research in behavior analysis in sexual behavior is ethically flawed, and professionally flawed. So always take the research looking at it with a little bit of caution, in this area. Right, but you can see this list. I use all these different methods for teaching. Let me give you now, so key concepts, we have about maybe 15 minutes left before I'm going to open it up for questions. No, 10-ish. 10-ish or so before I open it up for questions. Let me give you an example of what would be one thing I might do, right? So this is the most frequent call that I get, especially for, well, in the area of individuals that are on the more challenged side of the spectrum, what is now being referred to a lot as profound autism. That was actually started by parents, actually. That profound autism movement was started by families recently. Anyway, one of the main calls I get there is publicly displayed exposure and solo sex, right? People exposing themselves in public or masturbating in public areas. Right? Very first thing I do, stop having people call it masturbation until I'm sure the function is sexual. Otherwise, we don't know. Could it be medication problems? Could it be erection issues, physiological? Could it be pain? Could it be constipation causing genital touching? Could it be a rash causing genital touching? Could it be stereotypic behavior? Not sexual, but just he likes to, let's say I'm talking a male with like a penis. Let me see, maybe he flicks his penis with his finger. But it's not sexual. It's like the way he would manipulate his fingers, but he's flicking his penis because it flicks, right? But he's not feeling a sexual behavior, a sexual output from it. Then we're not going to call it masturbation and we're not going to treat it like sex, right? So, very first thing we do is analyze that function. What is it that he's truly doing? I'm defaulting to he here because I gave the example of a penile um, sexual behavior, right? So, um, how do I do this? Especially when you can't communicate effectively with the learner themselves, right? I take data. I have the parents take data at home. Every time that they are engaging in this behavior that we have now determined seems probably sexual, but we're not sure, we write down all these pieces of information as things happen. And then we become a detective, trying to figure out what's happening here, right? And you guys are all familiar probably with collecting data and looking at data and analyzing data and sifting through data and creating hypotheses. And then what do I do? So let's say, for example, I might have to teach public and private behavior as a concept. How do I do that? I use a lot of pictures. I use pictures from the client's own environment where I take actual pictures, and I use a lot of pictures from Google where I'm just looking up different stimuli in the pictures to have many examples. I'm talking 100 pictures, not five, 100 pictures of all different things. A lot of people in the picture, no people in the picture. No people in the picture at all. A living room that might be shared, might not be shared. A bedroom that is alone. A bathroom that is shared, a public bathroom versus a one toilet private home bathroom. I have many different pictures, hundreds, and we categorize them and we do discrete trial instruction and I bring out the token boards and we do the put with same and we do the, expressive identification programs, receptive identification programs just as if we were teaching any other discrimination task, right? Trying to general, and then we generalize to actual settings. And then I take a whole bunch of behavior pictures, all different types of behavior that people engage in. I take them from Google, I take them from the person's actual life, I take them from people that they actually know. And then what do they have to do? They have to look at the various pictures and they have to try to match them with public or private settings. I bring out my token board. I'm doing matching trials. It's discrete trial instruction. It's go back to your old programs where you were teaching discrimination of concepts, and we work on that. Right? And I throw in pictures of behaviors that I know my client actually does. Right? Make sure they're pictures that he or she actually does. And then I have to start to teach when and how to engage in behaviors that you want to engage in if you want to engage in masturbatory behavior, right? Solo sex behavior. And I don't have time to go into all these different teaching methods, but they are behavior analytic teaching methods, right? That places like Alpine and good ABA agencies would be more than familiar with, right? But we use prompting and priming and modeling and redirection, and we use visual cue cards. So like just for example, one thing I might do is make a masturbation task analysis, breaking it kind of down into different steps. But it always starts off with getting your masturbation card, right? I'm talking a pretty, impaired learner, right? Getting a masturbation card, right? And then once you get that card, it could just be doesn't have to have anything visual on it. It could just be like a red square. And once you get your red square, you could start to engage in masturbation and you could take your penis out. I'm using once again penile just as an example. Um, but where do I put this card? The card goes on the back of his bedroom door. So the only way he can get his masturbation card, which we will teach him he must have in order to take off his pants and start masturbating. The only place he could get that card is on the back of his door, which means his door needs to be closed. Right? So you see how you can use some creative ways to um, to develop um, to shape behavior, right? Through behavior analysis. Let me jump briefly to another side of the spectrum, right? So now I get a lot of calls with, I have to admit, they tend to be identified as males, as men, um, oftentimes with seeking female partners. That's not always the case, but it's a lot of the calls that I get, right? Certainly doesn't have to be the case. And the actions, the intention of the actions is typical. I want to date somebody, flirt with somebody. I want to, I'm attracted to them, so I want to be near them. I want to try to have sexual relationships with them, right? But how does it come off? Stalking, inappropriate communication, saying inappropriate things, inappropriate touching, and it's all social miscues. When I talk to the individual, they tell me I didn't want this all to be a problem. Like I just want to I like her. Or I like him. I don't want it to be a problem. But why did I get in trouble? Right? Now we're down the road of um working on perspective taking, working on subtle social cues, working on romantic behaviors that we know are um, socially appropriate in our culture, whatever your culture might be. And that's where I also have to ask family culture, right? So certainly, if I have let's just say, typical, for a lack of better word, because there's variations within the religions. But if I have a typical family who is Catholic versus a family who is typical, let's say, or even let's say more strict Muslim or more strict Jewish family, or other religions that I might or cultures that I might not even know about yet, and I have to learn about. Certainly, what I teach them to do will be different, right? So, how a man approaches a woman, in a typical Catholic environment is going to be different from the way a man can approach a woman in a stricter Muslim environment, right? So I need to know that first in order to work with my client on this stuff. And I cannot have my values guiding that person's actions. Above and beyond all of that, I also have to look at the law of New Jersey and the law of the United States and how that guides people. Mhm. And just I'm giving you one example. This is key concepts, and I'm at the point where I want to open it up to some questions. But one way I work on that is by doing movies. I host movie nights, or I haven't done it in a while actually, but I used to do it in the past. But I suggest that people do it. Or I just watch movies one on one, or I have the family kind of watch a movie one on one. Obviously, the movies are carefully selected. The points in the movie that I want to discuss are carefully selected. There are hundreds of opportunities for teaching in movies where you can pause actions, you can ask an individual what's going to happen next. You could do like what's going to happen next lessons. You could explain, there's so many things you could do by pausing a movie at certain points, pausing a television show at certain points, and kind of looking at the body language, the words that are used, the emotional inflections, and then kind of discuss why things happen. I'm not going to show you these are actual videos, but I'm not going to show you them in the nature of this at this talk. I don't have time. But one of the movies that is great, we go way back to 1978. We're looking at Greece, and um there are so many subtle sexual relationship cues in this movie, so subtle. But we all pick up on it. But individuals with autism do not pick up on it. So there's different clips. I have them here, but once again, we watch the movie and we do the lesson through the movie. Um, Here's just some things to consider, like, watch the movie yourself. Never, I never watch a movie that I haven't screened from beginning to end. Um, and you could see some of the other things here that we have to worry about. Just one thing I want to put up this slide before I get brought up on ethics charges for being a behavior analyst, but I am also a licensed psychologist, which means I can do whatever I want. But as a behavior analyst, I just want to say, I don't just show a movie to somebody and say, hey, go watch Grease. And that teaches them sexual behavior. Like, it's not the movie that's the teaching mechanism. The movie is the backdrop that I am using to get examples. But I am a behavior analyst. I'm using prompting, repeated trials. I'm using reinforcement of correct responding. I'm teaching about stimulus control. I'm doing rule-governed behavior. I'm using behavior skills training and using the movie as the model in what's called BST. As a family, I know you might not know a lot of these techniques if you're not a behavior analyst or if you've been around behavior analysis less. But certainly people at Alpine know things like all these different concepts and would understand how to use a movie as a backdrop to behavior analysis as the example and not as the treatment. Hey, go watch Grease and you'll be better. That's not the way it works, right? It's with behavior analysis in mind. And I spoke really quickly, but I'm from New York and New Jersey, so we're good. I know how to speak quickly. Are there questions in the chat or in the Q&A? Or if there aren't, do you want to write some in now? I see Amira like looking and talking, but
Hi. Thanks, Dr. Cicero. This is a great talk. We have a few minutes for questions, as Dr. Cicero said. So if anyone wants to put anything in the Q&A section, we can answer some questions.
well, there have not been anything in the Q&A. As you're typing, or if you're typing, I just want to say one thing. I am th this is actually my contact. Oh, not that person's contact. Oh, see, when you reuse slides, don't contact Sora Stein. She does not know I'm giving this talk, but contact me. Um, oh, by the way, Sora Stein, let me give a shout out since she's up there. She's an expert in this stuff. She lives in South Bend, Indiana, and I am. If you have a child that is more that identifies as female or that has traditionally biologically female body parts. That's usually not my area, but it is Sora Stein's area. So that actually is a good email if you have something. She's actually in South Bend, Indiana.
Dr. Cicero, we do have one question. How
Yep.
to address LGBT interests?
So, based on what the client needs. I mean, it's an interesting question because it's so like, how do we address the interests? Well, you might not have to address the interests at all if the individual has no problem with their interests, right? So if you have a person that has absolutely no problem identifying on the LGBTQ spectrum and has no issues with it, or you might want to introduce them to the LGBTQ community so that they do have access and they do, if they're unaware that this has been a thing forever in history and they're confused and they think it's just them. You might want to introduce them to the community itself and to resources in the community so that they know it's not just them and that there's plenty of people out there with that and then also helping them resolve if they are having an issue. You might also need to work with the family on that. If the family is having an issue with an LGBTQ identification, right? So we might have to work with the family to say, okay, how will we navigate this? Especially if someone is more challenged on the spectrum, or if someone is a higher functioning Asperger's, but is making riskier moves or doing behaviors that are a little bit less safe because they don't know how to do things. Um, they don't know how to make more safe choices, right? So we might have to be working on things that way. But once again, I don't know how to answer that question because there might not be an issue with LGBTQ identification if there's no issue.
Right. Thank you. We have another question in the chat. My son is 20 and has verbalized wanting a girlfriend, but has not wanted to have personal time. I'm not sure how I would know and address this. His hands are constantly in his pants since he's been a child. How would you address
So,
something like that?
right. So my first step is always trying to figure out, are you sure that, um, one, are you sure that he is not engaging in masturbatory behavior to completion? Um, Especially if you know he's in a private environment sometimes, right? So first of all, is he truly not, or is he actually engaging in it? The second thing is these are two separate concepts. Wanting to have a girlfriend and wanting to engage in solo sex behavior are two separate things that sometimes relate with each other, but sometimes don't. You could actually have a girlfriend, but only desire the
Mm.
relationship romantic aspect of the girlfriend. There are people out there who have girlfriends without sex. They have a romantic girlfriend, they have a relationship girlfriend, but they don't have a sexual relationship with that person, but yet they engage in masturbation on the side separately from their relationship with the girlfriend. So you would also have to figure out like what is it that your son really wants when he says girlfriend, right? Then, if he isn't masturbating, but yet there does seem to be a desire to do that based on his actions, touching himself when he's erect up, we might have to go in and teach the mechanics of masturbation. I have those slides as well, not here. But sometimes I do have to teach physical masturbation. I only teach penile masturbation. I don't teach um, uh, uh, masturbation with females who have biological female body parts. That I would leave up to someone like Sora Stein. There's also people in New York and New Jersey who work on that as well. But so I don't know if that answered your question, but yes, if he needs to be taught how to masturbate, we actually shape that like a skill.
Thank you. We have one last question.
Mhm.
How would you assess for a possible attention function and address a middle school age student who is touching staff and occasionally other peers on their genitals, backside, and chest?
So first of all, I wouldn't assume that it's an attention function, right? So the nature of the question seems to assume that you've already made that determination, right? So a behavior analyst goes in blind, right? I go in not knowing what I'm about to say. I go in completely blind. So 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 I wouldn't say something like, "How do I assess an attention function if?" Right? I just assess what is, right? So one thing I look at things like, well, first of all, that slide with all the different ABC things that I look at, time of day, person, but I also look at body part, like, is he erect at the time? So an erection in a boy is a good sign that 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 potentially there's sexual desire there. Not always the case, by the way. Boys get erections without sexual desire. But if he has if he has an erection and he's touching somebody and he's touching himself, and I keep getting that pattern, erection, touching self, touching person, erection, touching self, touching person. I get the sense that there's a sexual desire there in that, and not an attention-seeking function, but a sexual desire, right? Um, uh, Sometimes I look at other things as well. Does he do other behaviors for attention? And are the patterns the same, right? He also shouts out for attention. And it seems to have the same pattern as the touching people. Then I might assume there's an attention-seeking function, right?
We actually have two more questions in the chat.
Okay.
My friend struggles having friends. He will ask something inappropriate, then shut them out and is isolated. These are friends on the spectrum as well, so he has a hard time learning to be a friend. What do you suggest?
So my first suggestion is to not put all the blame on the friend, right? Because when I say blame, I say don't put all the explanation on the behaviors of the friend, right? I get this all the time. People with autism are oftentimes in environments where they meet other people with autism, right? So now you have two people with autism trying to be a friend. But oftentimes the moves are not predictable. So like I will teach my client how to say something, how to do something. And then the person who they're speaking to, who also has autism, throws a curveball in that I didn't see. And I'm like, oh, okay. Why did they throw that curveball in? Oh, okay, because they also have autism, right? So first of all, I never put all the explanation on my client's behavior because they're also into, and by the way, neurotypical people throw curveballs as well, right? When it comes to how they respond to people, right? And sometimes I say, oh, well, that was rude that he responded that way to you. That was actually really rude. That was unexpected, right? But how do I work on it? I work on it by helping them through situations. So I have them go through life and make their moves and do their things. And then they come to me on a weekly basis, let's say. Not always weekly, but they come to me on a weekly basis, and then we discuss what happened. What did you say? What did she say back to you? Tell me. I say, show me the text. I do it all the time. I say, show me the text. I want to see the text. I think she's making fun of me. I hate her. I'm blocking her. Show me the text. And I'm like, hello, she's joking. And I go through the and then I spot out to my client. And he's like, how do you know she's joking? Look at this word. Look at this word. Look at her ha ha emoji. She's joking. She was trying, she likes you. Oh, I shouldn't block her then. No, don't block her. Right? And then we go through and we do it weekly again and again with all different examples from their life. And that's how I usually just do it. I can't give you A plus B equals treatment, but that's how I kind of do it with my clients.
Yeah, all really helpful. Thank you. I
Yep.
have one last question.
Yep.
My son is 18 and started masturbating recently. Though he is minimally verbal, he is very much aware and does it very discreetly and privately at home. But we would
Yep.
like him to understand better. Who do we see or take him to help and understand and educate on sexual concepts? A psychologist or a therapist?
That would depend on what you want him to know and what the issue is. I mean, like right now, he's an 18-year-old male who masturbates, and he does it appropriately in private, and he doesn't talk about it. And he's doing his own thing. Um, Maybe he cleans up after himself. Maybe he doesn't. That needs to be taught. But my question would be, what do you want him to know? And as far as what you want him to know, if it's just about sex, that's just content. That's just academic content. People at Alpine can teach about sex. That's just academic content. That's like knowing, do you know about the Revolutionary War? Yes. Do you know about sex? Yes. I could teach you about sex. Um, if there's an issue, then your treatment providers are your behavior analysts, your sex therapists and sex educators, and your psychologists. Sometimes they all overlap. So you could have a person, Sora Stein is a behavior analyst and a sex educator. I am a psychologist and a behavior analyst with a lot of experience in treating sexual behavior, but not a license in sex therapy, right? So to guide you, I would need to know what you want, what your child needs, and then you would guide towards the appropriate professional.
Thank you, Dr. Cicero.
Not to mention occupational therapists can get involved in this too, as well. Don't their discipline as well sometimes is useful in this area.
Thank you so much.
Yep. So just one last thing, I mean, I'm not gonna throw it on Alpine to do this, and I know that you said it's just more of a April sort of thing. But I would be more than willing to do webinars such as this with individual topics where we can slow it down. So teaching masturbation, 1 hour. Teaching romantic relationships through movie nights, 1 hour. A slow teaching development, personal hygiene, 1 hour. I would be more than willing to do single subject webinars instead of this very broad webinar.
Right, yeah, because it's such a
If that
broad
would be
topic.
useful. Yeah,
Thank you so much.
no problem.
I'm going to go ahead and share my screen.
Oh, sorry. Did I have to stop sharing? Was that a prompt for me to stop sharing? There you go.
Okay. If you know someone who is looking for autism services, please reach out for more information on how we can help. Thank you for being here today. As a reminder, this webinar is a one in series of a free webinars that we are conducting throughout the month of April. All webinars are recorded. Feel free to scan the QR code on the screen to learn more about other webinars in this series. And finally, you will receive an email after this presentation with the recording and a brief participant survey. We are greatly appreciative of your feedback so we can continue to provide the information that's of value to you and your family. Thank you so much. Have a great day.
Thanks.
Thank you, Dr. Cicero.
Thank you. Thank you. Always welcome to do it.